critically based on those producers that include farmers, because 75% to 80% now of Gambia's food consumption come to agriculture, from agriculture. So access to finance or financial inclusion is key and very essential for the production sector. That include farmers and any other person or group of individuals that partake in that process.
The forum brought together key stakeholders. This includes participants from the banking industry, private sector practitioners, financial sector regulators, and researchers who critically discussed the research findings to enable governments make informed policy decisions on inclusive access to finance and recommend possible areas for further research. Alhaji Mbaye.
Meanwhile, there are confirmed reports of an unusually high number of deaths among children aged under 5 at the Kanifing General Hospital. At the last count, the figure stood at 17. But in the studio tonight, we have Dr. Isatou Bittaye, Director of Health Services at the Ministry of Health, for a live interview on the worrying situation. Good evening, Doctor, and a warm welcome to GRTS News.
Yeah, good evening, and thank you.
Well, as you just heard from the intro, at the last count, the figure was 17. Is there an increase?
No, and actually, the total number, what we reported today, we said 17, but the total number was 17 cases and then 16 mortalities.
16 mortalities.
Yeah.
So as it stands, the mortalities are 16,
yes,
but the cases altogether were 17.
Yeah, that was for the cases that were reported from 1st May.
Right.
Now, but when they've gone backwards to see since 1st March, they've seen a total of 38 cases.
38 cases.
Yes,
okay.
and 16, the deaths are the same, 16, but the other 16 were discharged, and then you have two were still, they say, admitted also.
Right.
So now the total count is 38. If they went back from on the 1st to see.
From the 1st of May.
The first reporting was 1st May.
1st May.
Yeah, so when they went back to 1st March, they think that they've seen similar cases, and the total count would be 38. And the total number of deaths is 16.
16. So were you able to manage to trace the cause of the death?
Yes, so we are. We can't, for now, for example, pinpoint what would I think is what caused that. But what happened is that we've encouraged all our facilities to have a very low threshold for reporting. Now, we prefer you to report, we investigate, and there is no problem. So we have a very low threshold. So that's why we are getting a lot of alerts. So if there is any increase in the number of sicknesses you have in any particular area, we want you to report it so that we investigate. If there is something, then we get it. If there is nothing, then we don't have to worry. So this is what is triggering all the reports that we are having and all the alerts.
Right. So reports suggest that the victims have manifested signs like breathing difficulty, fever, and vomiting, and we are said to have taken syrups. Does this have any linkage to the AKI?
Yes, most of them have fever, vomiting, respiratory symptoms. Some have convulsions and without convulsions. So from when these experts met and discussed, what they thought is the number one likely cause is maybe meningococcal disease. It's a form of bacteria that sometimes presents like this. So that's the first one on our list. And then we are thinking of organophosphates like snipers, and those type of things, but drugs is low on the list, on the list.
Right. So, what for parents of children in this age bracket? What should they look out for?
So, what we've seen is that most of the cases, they don't come early, and sometimes the referral is delayed. They go to one drugstore to another drugstore. So most of the cases, they have visited 2 drugstores or a facility before coming to the hospital. And when they come to the hospital, it would have been very late, and they don't spend long time. The hours, they are less than 3 hours when they come to the hospital. The ones that succumb, the others survive. So we want people to go to the hospitals very early if they have symptoms and signs like respiratory distress, if they have difficulty breathing, if their necks are stiff or anything like that, or they feel like they're collapsed, or the fever is very high. they should report to the hospital.
So what's the ministry currently doing to be able to know the cause of this death?
So this is what happened. Investigation is ongoing. The last case we have that had similar symptoms was last Sunday, and since then there's not been any case. But the teams are going to the houses to check, to ask them questions, to see what drugs they have. Did any member of the family have it? Are they all in the same area? You know, those type of things, so that we can pinpoint. And those in the hospital also will take samples and also do some investigations.
So what actually informed the ministry? How did the ministry or even the health facility come to realize that most of these children are dying from this particular, like at a go?
No, now what we've seen is the AKI. Now most facilities, they don't wait till end of the year to say, oh, we analyze our deaths and then we find that it's decreasing. Now as you go, every month you analyze your sicknesses. We have these people with fever, we have these people with mortality. So if you see any increase, you have to tell us, then we start to report to see whether there is any reason for it. So you also compare the years before and these years to see whether there is any trend and if there is increase or not.
Okay, so as it stands, there is it is not attached to any disease or anything, the deaths,
so
or the cases to say?
Yes, for now we think that it is some bacterial infection that leads to shock and causing this. But it could be, what our investigation is wider than that. It could be organophosphates, it could be anything else. But we are not saying that that's it. But you know, when we looked at all the symptoms and the way it presents and everything, it looks like something like that.
Okay. So finally, do you have control over the situation, or are the cases only limited to the Carnifing General Hospital?
So we've sent in notice to other areas, and we are seeing, but we've not seen yet this type of reports. But even Carnifing, the last one they saw that looked like this was since on Sunday.
Okay. All right, Dr. Bittaye, it was a pleasure having you here.
Yeah, thank you very much.
Well, that was Dr. Mustapha Bittaye, the Director of Health Services at the Ministry of Health. Now, moving on, a 2-day